smoking, which our colleague Dr. Ali Chalak is also an investigator on and will be presenting this webinar about the elasticities of demand for cigarette and waterpipe tobacco products in 3 Eastern Mediterranean countries. Dr. Chalak has earned his Bachelor of Science degree in agriculture from the American University of Beirut and completed his Masters of Science in Tropical Agricultural Development at the University of Reading in the UK in 2001. His PhD is in Applied Economics at Imperial College London in the UK in 2008. Dr. Chalak worked in consulting in the UK between 2006 and 2009, where he was involved extensively in economics and customer research conducting for a variety of water and wastewater companies and other utility and infrastructure providers in the UK and Europe. He joined the Faculty of Agricultural and Food Sciences at AUB as a faculty member in 2009, and he's currently an associate professor of applied economics. His main research interests lie in the areas of agricultural and food economics, health policy, non-market and environmental valuation, applied choice analysis, transportation economics, and agrarian political economy. He's actively involved in independent economics consulting for both local and international clients from the private, public, and voluntary sectors. Dr. Chalak's research and consulting have yielded several publications in peer-reviewed journals. I'm happy to introduce Dr. Chalak as a team member in this research project, and to give us more information about elasticities of demand, particularly for cigarette and waterpipe in the 3 countries where we conducted this research, in Jordan, in Lebanon, and in the West Bank. Thank you, Dr. Chalak.
Thank you, Dr. Chalak. The floor is yours. I will make you now a presenter, and you can share your slides.
Thank you very much. Yeah, I will just do that now. Can you see my slides?
Yes, it's very clear. Thank you.
Excellent. Thank you very much. So thank you, Sarah, for convening this talk, and I'd like to thank Rima and Abstentia for her introduction of myself. I've just been off a meeting with her precisely, so I think she's fine. Yeah, today's talk is about work I've had the privilege to conduct recently on mainly focusing on waterpipe tobacco smoking, but in the context of general smoking in the area where Lebanon is situated, so in the Eastern Mediterranean area, encompassing also Jordan and West Bank, Palestine. Unfortunately, Egypt was supposed to be part of the study, but due to difficulties that many of you could figure out, we could not conduct the field work in Egypt. So unfortunately, the study had to be restricted to these 3 countries. But even despite all that, the insights are still valuable, I believe, and I hope to convince you today. So the study, so my presentation is again on the elasticities of demand for cigarette and waterpipe tobacco products in 3 East Mediterranean countries. So that's Lebanon, Jordan, and Palestine, the West Bank, to be more specific. Here are the names of the co-investigators. So Dr. Rima Naash and Dr. Ramzi Saloom are the 2 principal and co-principal investigator. I have participated in this study in my capacity as applied economist and an expert in discrete choice experiments and volumetric choice experiments that are, a cornerstone of the study. Just a few declarations. So this research presentation is a part of a series of research papers produced by the Eastern Mediterranean Consortium on the economics of waterpipe tobacco smoking, known in its, or the otherwise you could refer to it with the acronym ECON-WTS. And this consortium is basically a project funded by the International Development Research Center of Canada, and I hereby declare no conflict of interest. So just to start by way of a quick background, as many of you know, waterpipe tobacco smoking is a traditional tobacco use method that originated in this very part that the study focuses on, i.e. the Eastern Mediterranean region that some people refer to as well as the Levant, or the Middle East, part of the Middle East at least, and has had a global resurgence in recent years, especially among young people, and under the guise of new flavors and new packaging, as it were, of this traditional product. So waterpipe smoking rates in the region are among the highest in the world, if not the highest. I think they are the highest. And this has been partly encouraged by the fact that the prices that these countries enjoy, or actually I should be using a more negative term, are subject to, are the lowest in the world among all WHO regions. So this has been part of the encouragement and part of the reason why youths have been so keen on using waterpipe smoking in the Eastern Mediterranean. Tobacco product prices are a very important factor when considering that decreasing affordability is one of the most, if not the most effective measures to reduce uptake of smoking among young people, namely through policies like taxation, but also minimum unit pricing and other policies that are fiscal in nature and that focus mainly on increasing the prices of these harmful products, namely tobacco products, in order to reduce their use among certain demographics of the population or the population at large. The WHO Framework Convention on Tobacco Control, or the FCTC, otherwise known as the FCTC, has recommended time and again that taxation policy should take into account price elasticity of demand in order to reduce consumption and prevalence of tobacco use. Without a proper understanding, otherwise, of elasticity of demand, basically taxes would be designed in the dark because we wouldn't understand how, or other tools, of course, or minimum unit prices or other tools would be designed in the dark because we wouldn't have an idea of how consumers would react to price changes. And elasticity, for those of you who don't know it, just to define it very briefly, it's a very intuitive concept. Even though it's a cornerstone of economic analysis, it's basically the proportion change of demand in response to change in price. So, for example, the elasticity of -2 would mean that if the price increases by 10%, quantity demanded or demand would drop by 20%, -20%. If price increases by 5%, quantity demanded would drop by twice that, by minus 10%. So it's the ratio of the percent change in demand in response to a percent change in price. It's a very handy and intuitive tool for understanding price, for understanding demand responsiveness among consumers. So the FCTC also recommends that all tobacco products should be taxed comparably to avoid unintended consequences, such as product substitution or increases in illicit trade. Again, elasticities could be very handy here in understanding how substitutions would occur between products which prices have increased and other products which prices didn't increase as much. And hence this recommendation, which is very wary of substitutions between different products that would actually undermine the very goal of many taxation policies. On the other hand, unfortunately for us, the research teams, to put it cynically, there's no estimates available in the Eastern Mediterranean region for adult demand elasticities for smoking products. And if they are available, they are mostly available for cigarette smoking. So there's nothing on waterpipe tobacco smoking. So there's very little by way of demand elasticity studies. Some of the available studies are quite dated, and if they are available, they are restricted to cigarette smoking. So this is basically the gap that we in the ECON-WTS consortium have set out to fill. So the aim of this presentation and of this study is to present recent and comprehensive on and cross-price elasticities of demand for cigarettes and waterpipe tobacco products in these three Eastern Mediterranean countries that I've just mentioned: Lebanon, Jordan, and Palestine, the West Bank, of course, and discuss the implications of these results to taxation and other fiscal policies aimed at tobacco control in the Eastern Mediterranean region. I mean, I'm assuming that I will be presenting and that the questions will be left to till the end, unless the organizers want me to entertain questions within the presentation. I'm happy to do that. Yes. So
if anyone has any questions, please can you write them in the chat box, and I will be we will be answering them in the end. Dr. Chalak will be attending.
Okay.
Thank you.
Okay. So moving on, in terms of the methodology adapted in order to obtain these elasticities, this study is basically survey-based, based on large-scale surveys conducted in each of these three countries. There's more on this in later slides. And that survey is basically composed of two main components: a household questionnaire and a volumetric choice experiment, which is the core exercise from which the elasticities are derived. So starting with the which I will describe in detail in later slides. So the data were collected using nationally representative household samples of adults aged 18 or more. 18 or more in the three countries, and the participants were selected using a multi-stage cluster sampling approach with probability proportional to size random selection method. So basically, in each country, the data collection, the sample selection proceeded in two stages. First, selecting well-defined geopolitical clusters within each governorate, and then within these clusters, within these clusters, housing units were selected. So it followed pretty well-established sampling schemes, and enough to make us claim confidently that these samples were representative of households in each of these respective countries. And participants were enrolled from all the 8, 12, and 9 governorates in Lebanon, Jordan, and and the West Bank, respectively. So geographically and socio-demographically, so we're confident that the samples are geographically and socio-economically and socio-demographically representative in these three countries. So of course, study staff consented participants and used, to participate, and used electronic tablets to administer these survey. The household questionnaire, which is one main, one of the two big components of the survey, assessed socio-demographic characteristics of the respondents, of the households, and of course, more importantly, cigarette and water pipe smoking behavior. So there was whole sections on gauging cigarette and water pipe smoking behaviors. And there's a big, another study and a paper coming out of it on the prevalence of smoking, for smoking of all these products in all these three countries. And there's a manuscript under, that will be submitted soon to a peer-reviewed journal out of it. And these components were based on prior validated surveys. So we made sure that, especially when it came to measuring smoking behavior, we made sure to base our these components on prior validated surveys. Questionnaires were pre-tested using cognitive interviews in each of these three countries to ensure respondent comprehension, and the study protocols were approved by the institutional review boards of the three participating institutions that conducted these studies, one in each of these countries. So the American University of Beirut in Lebanon, the leading institution within the ECON-WTS, and also the Jordan University of Science and Technology in Jordan, and the Birzeit University in the West Bank. Now, moving to the core exercise, which again I'm terming a volumetric choice experiment. Now, volumetric choice experiments are a recent development on the more established technique, which we call discrete choice experiments. These volumetric choice experiments, and I will show you how they work in the next slide. They offer the advantage of understanding demand for products in the lack of or absence of actual market data. So they are basically a hypothetical technique representing people with hypothetical market situations from which we can collect their, simulate their purchasing decisions, and from which we can estimate elasticities as if these data were derived from real market situations. So given the fact that there's very little market data available in all these three participating countries to which to draw on which and derive elasticities from, we had to resort to this hypothetical technique, but which is a well-tested technique and that yields well-designed, of course, that can yield very robust elasticity estimates. And it avoids very often, because we're using this hypothetical technique, they have the advantage of avoiding many of the endogeneity problems inherent in actual market data when these are available, of course. And when we say when available, that means usually very often available in very aggregated and poor shape, in a way that could very often lead to biasing the elasticity estimates. Not always are market data, actual data, superior to these hypothetical data because they suffer from their own set of problems, even though they are derived from real life situations. The elasticities derived from them could very well end up being very biased. This is one of the main advantages of volumetric choice experiments and choice experiments in general, in that it can, by randomizing the determinants of choice and the factors influencing purchasing decisions at the individual level, we can robustly overcome these endogeneity problems. So by simultaneously offering multiple distinct, what we call volumetric choice, which will become clearer in the next slide, between competing products, these volumetric choice experiments would allow us to estimate the full, complete set of own price elasticities, so the demand responsiveness to a change of the in the price of this same product, but also cross price elasticities. That means, for example, the change in the demand for a cigarette product in response to a change in the price of a competing product, which would be a Waterpipe product. So these cross-price elasticities would also allow us to understand how different products can be substituted one to the other in case of one or more change in prices and market prices. So the cross-price elasticities are notoriously difficult to estimate when real-life market data are available. Very often, and this is an added advantage of volumetric choice experiments. Very often, published studies that are based on real market data are often restricted to own price elasticities, meaning that they will have to ignore all these substitution patterns. The added advantage of our study is that because it uses volumetric choice experiments, it allows us to also understand these substitution patterns. So this is an example of a volumetric choice experiment. So here, this directly lifted out of our questionnaire. So it says here in the text above what we call the choice set, based on the following prices. So I'm reading the text right above the table. Based on the So based on the following prices, think about the number of cigarettes and Waterpipe products you would purchase. So here you have, so here we had 8, our market research allowed us to, to categorize the different smoking tobacco products available in each of these 3 countries, categorize them under 8 broad categories. Premium cigarettes, so usually foreign brands of cigarettes, discounted cigarettes. So that would mean it's most often locally produced cigarettes, especially in Lebanon, but also in Jordan and Palestine. Again, for water pipe products, premium water pipe tobacco products and discount water pipe tobacco products, which tend to be cheaper. Also, the more traditional non-flavored water pipe tobacco products. Note that the products 3 and 4 are the what we call flavored water pipe tobacco products that have been available on the market in the past couple of decades, and that are more popular among younger generations, and that actually probably account for most of the increase in recent increase in water pipe tobacco smoking. While non-flavored water pipe tobacco is the more traditional water pipe associated with older generations and less with younger generations, and this is product 5. Also common in some water pipe home delivery, which is common in most common in Lebanon, deliveries of water pipe, which is more a service. So you would order a water pipe which comes, the whole water pipe along that would be delivered to your home, along with its charcoal and everything, and also water pipe smoked in cafes. Again, premium and cafes, cheaper cafes, which would be up to 8. So that would be an example of a choice set presented to a respondent. So an 8-way choice. So the respondents had, and each one of these products, of course, had its own price. The price combinations, of course, the product 5, which is the non-flavored water pipe tobacco, was replaced in Palestine by roll your own cigarettes products, because non-flavored water pipe tobaccos didn't turn out to be very common there, and roll your own cigarettes were more common in Palestine. So this was the main difference between Palestine and the remaining 2 countries. Otherwise, it was usually the same structure, a choice, an 8-way choice between these 8 products, whereby the prices, each product price varied across the choice sets. Okay, so this is a unique price combination within this choice set, and given these products and their corresponding prices, respondents could actually state how many units of each of these products they would choose. So randomly, so that could be, for example, to give you an example, a certain respondent would choose to buy no premium cigarettes, to buy 4 packs of discount cigarettes, and then no premium water pipe tobacco or discount tobacco, no non-flavored water pipe tobacco, neither a water pipe home delivery, and 0 water pipe cafe session in a premium cafe session, and then 2 water pipe smoking sessions in a discount cafe. So that could be an example of how the data could be filled. So respondents could actually choose to, to state 0 units of any of all products, or choose only 1 unit of one product, or to choose 1 or more units of more than 1 product, up to 8 products. So this is how it works. So so the way it worked for each respondent, so we designed, this is an example of a choice set. We designed 32 such choice sets. Now, since a respondent could not be asked, sensibly to answer all these 32 choice sets, we blocked them into 4 blocks of 8 choice sets each, and each respondent was assigned a block randomly from which 8 such choice sets he had to answer the 8 choice sets of this block. So each respondent basically had to answer only 8 out of the total 32 choice sets, which we generated according to rigorous experimental design principles. And the difference being here between choice sets would be the combination of prices across the 8 products, because we had for each product 4 possible prices from which only one price could be allocated to one choice set. So you can see here that there's a nearly infinite number of choice sets that could be designed. We only chose an efficient 32 subset of 32 such choice sets to administer to respondents. So moving on, so how did we analyze the data? We analyzed the data by means of a zero-inflated Poisson model, which is basically, Poisson models are, because the data are count data, as you have seen, respondent actually chose how many units of each product they would choose. So the data are counts, basically. And with these counts data, it's usually the Poisson model is a usually model of choice for analyzing count data. And because of the high level of censoring in the data, that is the high level of cases where respondents chose 0%, 0 units of one product, we had to account for this, what we call censoring, by way of augmenting the Poisson model and estimating a zero-inflated Poisson model instead. So for any tobacco product, for any of the 8 tobacco products, the model had 2 parts. A logit model to account for the excess zeros for the censoring, and that actually accounted for socio-demographic characteristics, education, gender, region coming from, but also the current smoking status, whether the person is a smoker or non-smoker. And the main model from which the elasticities were derived, namely the count, the Poisson count model. So in each, so for example, for the premium cigarettes, for example, the Poisson model for the premium cigarettes had one coefficient for the price of the premium cigarettes, and also 7 cross-price coefficients, one for each of the prices of the competing products. So the coefficient for the own price allowed us to derive an own price elasticity, and the 7 cross prices, again 7 cross price elasticities, plus of course controlling for income in order to make sure that the price elasticities were not biased by any income effects. So in each country, 8 zero-inflated Poisson models were estimated, one for each of the 8 products. So we had 24 models in total, 8 times 3. And since the coefficients for prices were logged, since the price variables were logged, then the coefficients could directly be interpreted as, very conveniently interpreted directly as elasticity. So in terms of the results, so the survey was completed by a total of 1,680 respondents in both Lebanon and Palestine, and a bit more than that, 1,925 in Jordan. More or less 50% of the samples were females, and the other 50% were males. We had difficulty to achieving this quota in Jordan, so we had only 45% female and 55% male. Lebanon stood out in terms of smoking prevalence in general. Substantially larger percentages of current general smokers existed in Lebanon, 71%, compared to Jordan and Palestine, which had smoking prevalence of more or less 40%. And that pattern was even more pronounced, much more pronounced in current waterpipe smoking, whereby in Lebanon, almost 40% of the population smoked, which is at least 3 times more than the percentage in Jordan, 11%, and that in Palestine, which is 13%. So much higher prevalence of smoking was observed in Lebanon. And this is actually, we're looking into the determinants of these phenomena in our prevalence study. Age distribution was similar across the countries, the 3 countries, 2/3 were aged 45 or less. Lebanon stood out in terms of a higher proportion of full-time employment. Remember that note that the data collection was conducted in September 2019. Now I guess the unemployment rate has soared up because of the unprecedented economic crisis that we are facing. So I suppose the numbers have shifted quite substantially for Lebanon to make us enough for us to register higher unemployment rates than Jordan and Palestine. But that remains speculation. I'm not aware of any recent. I'm not privy with any recent censuses of employment in Lebanon. As for education, the proportion of respondents with higher education was highest in Jordan compared to Lebanon and Palestine. So moving to the results, some descriptive statistics. These are the stated purchases of tobacco. So not the actual prevalence data, but actually the data, some descriptive data of the stated purchases in response to these choice sets, which I showed you an example of in an earlier slide. Here, you could see that Lebanon stands out in its much higher stated purchases of all cigarette products compared to Jordan and Palestine. And this is very much in line with the prevalence, with the actual prevalence data results that we obtained. And this is very much driven by the fact that that respondents in Lebanon exhibited the lowest proportion of null stated purchases across all products. Although these are very high levels of censoring for Lebanon, but the censoring all the same was much lower than for Jordan and Palestine, where you see that, you know, we could not do without a zero inflated model or a model that accounts for this censoring, because, you know, for many products, almost 90 or 95 or even 99% of the choices were zero. So a zero inflated model actually, you know, accounted for this fact and allowed us to derive still robust elasticity estimates. Okay. So moving on to the actual elasticities. In terms of cigarette smoking, elasticities, you know, there was a relative parity in terms of the elasticities achieved, you know, observed in Lebanon, Jordan, and Palestine. So more or less unit elasticity. That means in all three countries, a 10% price increase would be met with more or less 10% drop in demand for these products. So for these premium cigarettes, the elasticities were more or less similar across the countries. For discount cigarettes, you could see that, you know, here, because these are cheaper products targeted by, because these are cheaper products, that you could see that the price responsiveness observed was lower for these products, meaning that, you know, you know, as symbolized by price elasticities that are lower than 1. So you could see here that for Lebanon and Jordan, price elasticities were lower than 1. That means that quantity would respond to prices, but less than proportionately. So there's less sensitivity to price for discount cigarettes, as would be expected, at least in Lebanon and Jordan. While in Palestine, the elasticity was still unit elastic there. What are the reasons for this is still under investigation. So moving on to, so we didn't notice any significant results for roll your own cigarettes for Palestine. So moving on to Waterpipe, you know, home purchase, store purchased Waterpipe tobacco products. You could see that Lebanon stands out in its higher levels of elasticities for both premium and discount Waterpipe product compared to Jordan and Palestine, whereby the elasticity was much higher than 1, meaning that that the consumers in Lebanon were much more responsive to price changes. In fact, the quantities, you know, the demand is almost twice proportional to the demand change is almost twice proportional to price change in Lebanon, while in Jordan and Palestine, you observe that the demand responsiveness is rather inelastic because of the elasticity lower than 1 in absolute value. Now, moving on to Waterpipe services. So we considered here that home delivery of Waterpipe tobacco is again, could be, you know, could be thematically joined with smoking Waterpipe in a cafe, simply because you're ordering the whole service, and rather than the tobacco product itself, and making your own, preparing your own Waterpipe. So rather than going to the cafe, you're ordering the Waterpipe to your own home. Again, Lebanon stands out in its much higher responsiveness to prices compared to both Jordan and Palestine, whose demands, where these are significant, are rather inelastic, except of course for premium Waterpipe cafe smoking in Palestine, which is almost unit elastic. So Lebanon in general, in terms of Waterpipe smoking, tends to be much more price responsive than Jordan and Palestine. And this is most probably, at least partly, if not almost entirely, driven by the fact that smoking rates in Lebanon are much higher. So when we talk about high demand, that means higher expenditure on these tobacco products. That means probably higher responsiveness to prices as compared to low use settings like Jordan and Palestine, where price changes would not have a high impact on expenditure, and in turn would not be where, as a result, quantity demanded would not be as responsive there as in Lebanon. Now, further insights, by way of further insights and discussion, we managed to find some studies on smoking elasticities with which to compare ours with Lebanon and Jordan. Unfortunately, no such studies were found in Palestine. So we're going to restrict our comparisons to previous studies to Lebanon and Jordan. So for Lebanon, compared to previous estimates in Salty et al. In a paper published in 2015, price elasticity for premium cigarettes was higher than the one published in this study. But it's important to note that elasticity for premium cigarettes in our study were higher than those for imported products in this study, which tend to be typically premium. While discount cigarettes, their elasticities are lower than for their counterparts and local cigarette products in this published study. Price elasticity of premium water pipe was more or less similar, was very similar to one published in Salty et al. Cross-price elasticity estimates between water pipe and cigarettes were close to zero, whether in our study or in the Salty et al. Study, meaning that water pipe and cigarettes are are distinct experiences, and smokers of water pipe and cigarettes see them as distinct experiences. In fact, in our prevalence studies, we saw that there's they overlap very little. In terms of smoking behavior. In Jordan, compared to a study published in 2014 by Swayze and Chalak, unfortunately, this study doesn't differentiate between premium and discount cigarettes. So our price elasticity for discount cigarettes was more or less similar to their general published elasticity, which was -0.6, while the price elasticity for premium cigarettes published in our study was higher, understandably, and as expected, than their aggregate elasticity in Swayze and Chalak. In general, to add, cross-price elasticities between store-purchased water pipe tobacco and water pipe cafe smoking in our study, I mean, these are results which I'm not presenting here for lack of time and space, tended to be very weak and inconsistent, meaning that these two experiences, again, are no close substitutes. So not only are cigarettes not substitutes to water pipe smoking in general, but even within water pipe smoking, buying your water pipe tobacco and smoking at home is one experience, while going to the cafe and smoking water pipe in a cafe is a completely different experience, meaning that tackling these products by means of separate taxation policies could make sense in that case. But that's still to be, we still intend to simulate these effects in future tax simulation, in a future tax simulation study based on these results. Our estimates in this study are broadly consistent with previous ones, but differences may be attributed to differences in methodology and temporal context. But then again, this remains speculative. So in general, in conclusion, this is the first study to offer robust information on the economic relationship between cigarettes and water pipe smoking in Eastern Mediterranean countries, where both products are very highly prevalent. There's strong evidence that raising tobacco taxes could significantly reduce tobacco use in the EMR while increasing government revenues, especially in Lebanon, where high elasticities prevail, but also in Jordan and Palestine to a lesser extent. This is a very timely study in terms of its policy relevance, because it offers the data to evaluate the potential effects of taxes and other fiscal tools in these three countries, but also potentially allowing us to extrapolate beyond these three countries to other countries in the region in terms of understanding tobacco consumption patterns, public revenues that could be generated out of possible taxation or other fiscal tools, and also the substitution between cigarette and water pipe tobacco products on the price increases affected by these tax policies. And these are the references used throughout these this presentation. I apologize for taking too long to present these results, and I'm open now for any questions you may have. Thank you very much.
Thank you, Dr. Chalak. I have not received any questions on the chat yet. However, if anyone does have any questions, you are welcome to unmute yourself and ask the question for Dr. Chalak. Thank you. Also, you can follow us on the website and social media accounts for the recording for this presentation and everything linked to this webinar. Thanks again.
So I can read in the chat box. I think there's a question here in the chat box. Was it a population-based study? Yes, it was a population-based study. So as I mentioned in the slides, these are nationally representative surveys. So we made sure that, I mean, I'm not an expert in sampling frameworks myself, but we made sure in the 3 respective countries that the data collection, what I can assure you is that the data collection was done in such a way to draw nationally representative surveys. So we can, because this is a study that should generate, among others, solid prevalence figures. So we were very cognizant of this. So yes, it is a population-based survey. Was it only for, I mean, elasticity, as I said, elasticity estimation was a main component because, I mean, as the study is titled, the consortium itself is titled Economics of Waterpipe Tobacco Smoking in the region, ECON-WTS. Yes, that was a main component of the study to derive elasticity estimate. But the survey on which the study is based, as I said, has another extensive household component survey from which actually we were able to compile some very interesting prevalence data. We're still analyzing them. We generated the first cut prevalence data and we compiled them into a manuscript that we intend to submit soon. I'm not sure if other team members are planning to present these results anytime soon, but I think we're ready to present some of these prevalence, general prevalence data. So there's another question here from, I think it's our own Dr. Ghazi Zatari, if I'm not mistaken. So how do you think, at AUB, right? So how do you think the recent dramatic devaluation of the currency in Lebanon and the sharp increase in tobacco prices will impact tobacco use, cigarettes and water pipe tobacco? That's a very good question, Dr. Zatari. We are very well aware of this. And we were joking about this internally in the team. We started collecting the data right at the onset of the economic crisis in Lebanon. The inflation was nowhere near its levels now. In fact, you know, if there was any inflation, it would have been barely felt in prices of tobacco products. So the prices we had would be relevant to, you know, to do simulation in Lebanon up to, you know, summer 2019. Now, what we are trying to do, because of this problem, because of the price ranges we considered in our volumetric choice experiment were actually based on the prices that were prevalent then. So the increases, mostly the price increases relative to the hypothetical price increases relative to the typical prices encountered in the market then were double or triple at most. I'm not sure what the prices are. Nowadays, the prices of tobacco products are 5 or 6 times their prices, you know, prevailing a year ago, such that even using our hypothetical data, which is designed in a way to accommodate these, even our hypothetical choice experiment which has the advantage of accommodating these extravagant price increases, could not actually foresee such price increases. We were actually looking at, we had some money left to conduct some more field work to understand the implication of these recent price increases. But unfortunately, with the COVID-19 situation, we're still not able to conduct any data collection. We had a second cut survey. We're still waiting to conduct this data collection. And I imagine that the elasticities, which are very high in Lebanon already, could substantially increase further. So I wouldn't be surprised to see elasticities for Waterpipe product in the order of 3 or 4, -3 or -4, indicating very high price responsiveness and price sensitivity. But I mean, that remains speculation. I hope I answered your question. So there's another question: who was the funding body? So it's the international, it's IDRC, so it's International Development Research Center, which is based in Canada, and which is very active in offering grants in Lebanon, and at AUB especially, not only in the Faculty of Health Sciences, also in my own Faculty of Agriculture and Food Sciences. Thank you very much, Jawad, if I may.
Okay, thank you, everybody. I'm assuming nobody has any more questions for Dr. Chalak. Thank you for attending today's webinar, and we look forward to seeing you in the next webinar. Dr. Chalak, Dr. Jawad is asking you to share the manuscript.
Sure. I mean, I hope it gets accepted soon, before the effects of the economic crisis in Lebanon would further, make our results obsolete. But yes, I will surely be, we will surely be sharing this manuscript when it gets published, hopefully sometime soon.
Okay, thank you, everybody. As I said before, the recording and the presentation and everything related will be available on our social media and at the website. Thank you again. Have a nice day where you are.
Thank you, Sarah. Thank you, everyone. Bye.
Thank you. Bye-bye.